Hi, go ahead.
Well, my name is Ron Whistler. I'm 75 years old. I ended up coming to Northland for two reasons, two issues. Severe migraine, which I'd been in for about 3 months. I'd been diagnosed with migraines ever since I've been 16. They said as you get older, they're going to get better. As I got older, they got worse. The other issue is lower back pain in the L4, L5 area. Now, with respect to both issues, the pain area has been tremendous. I've taken just about every opiate you can imagine. I've had every kind of surgery you could imagine with no relief. So basically, I was at my wit's end and was very, very I guess you would say, despondent or just didn't feel very good about what's going to happen for tomorrow. So we were looking around and we was recommended, say, well, why don't you try something different? So I started looking at alternative medicine. Somebody said, well, why don't you come into Northland, which my wife and I did, which she has back issues as well. The first thing that was very noticeable to me, and which anybody viewing this ought to take into consideration, is that they said, well, let's see if you're a good candidate that we can help you out. That was kind of refreshing because it meant that they were going to look at me personally to see what they needed to do. The second thing that was impressive when, as we got more acquainted with the facility here, is that in deciding what they were going to do became a team approach, which means that I was not being treated at the whim of one person's idea of what should be done. It became a collective effort as to how well we can get you out of your pain issues. And I'm not quite sure just how long we have been coming here now, but I have a totally different outlook on life. I can't say that I'm completely out of pain, but certainly better than what anybody has ever been able to do before. And I don't have to worry about taking drugs to get relief from the pain. I think that is probably the biggest and best factor that I can explain to a person that may be watching this video. The other point is that they truly live what they preach. Because when you walk in here, everybody is friendly. They know who you are. Even though you just sign in with a little computer deal, you get the deal, good morning, Ron, how are you today? And I can say, I feel lousy. And I know that they're going to treat me different than they would if I'd have come in and said, well, I'm okay. So I get that personal feeling, which is really adding to the confidence level that I think a person gets, that I think is very important to medication, is that you have confidence in where you're going. I had lost all confidence in medical ability to get me out of pain until I finished, or I'm not finished, until I've been going to the Northland area. I'll let you go from there.
Yeah, that's wonderful. Let me ask you a question. Before you started coming here, what were your headaches preventing you from being able to do that you really wanted to do?
Well, that's kind of a question that the answer is I couldn't do anything. So I'm not avoiding the answer. Mm-hmm. It is just a truism. I took so many drugs. I hurt so bad that it was hard to get out of bed. I noticed a difference in me when I was on them. Mm-hmm. They notice a difference in me now. And my kid, when I say my kids, they're 57 or 54 and 50. And in fact, as I'm doing this video, talk to our son, has my granddaughter that's a Winnetonka cheerleader that's in determining what is going to be the best procedure to work with her and her back issues. So it's, I guess that's proof in the pudding that we believe in what I'm telling you, and that we have our whole family and quite a few friends that are attending here would have the same results that I'm having.
Well, great. And we really appreciate you, and we love having you here and getting you better and seeing the difference in you from when you first came in to how you're feeling now, and truly honored to have your granddaughter coming in as a patient as well. So thank you very much.
That is